The bioactive molecules from snake venom can be used as a potential lead compound for cancer drug development. Research are progressing in this field. Come on, let's see in detail. This is Soumya's capsules enriched with knowledge.
Cancer is one of the leading causes of morbidity and mortality worldwide. Surgery and chemotherapy are still the main strategies for cancer therapy. Target therapy is becoming more popular in cancer treatment. This target therapy focuses on specific molecular target and usually causing less toxicities. Recently, the compounds purified and characterized from snake venom showed tremendous potential as agents targeting specific molecular pathways in cancer cells. Snake venom are complex mixture of proteins, peptides and other bioactive molecules secreted by the venom gland of snake. These are injected by unique fangs of snake to disable and digest their prey. WHO has placed snake bite envenoming on its list of top 20 priority of neglected tropical diseases. It kills more than 1 lakh people and cripples 4 lakh people annually. Even though snake bite envenoming is a life-threatening public health problem, snake venoms are recognized as a potential resources of biologically active compounds. Snake venoms are also developed as drug leads in the modern drug industry. For example, captopril was the first angiotensin converting enzyme inhibitor approved by FDA in 1981 for the treatment of hypertension and some type of congestive heart failure. Captopril was actually designed based on BPP5A, a bradykinin potentiating pentapeptide isolated from venoms of Brazilian pit viper. The chemical components of the snake venom include enzymes and non-enzymatic components. The enzymes include phospholipase A2, L-amino acid oxidases, metalloproteases, serine proteases, 5-nucleotidases, acetylcholinesterases, and hyaluronidases. The non-enzymatic components include disintegrins, three-finger toxins, Kunitz peptide, cysteine-rich secretory proteins, C-type lectins, and natriuretic peptides. There has been a long history of research on exploring the therapeutic potential of snake venoms for cancer. In the early stage, the study was on the inhibitory effect of crude snake venom towards tumor cells, but it showed doubtful results. The isolation and characterization of the components from snake venoms began in 1940s. After that, numerous components including enzymes, non-enzymes, proteins and peptides were purified, sequenced and structurally elucidated. L-amino acid oxidases was first isolated and characterized by Singer et al. From cottonmouth snake venom in the early 1950s. It is an enzyme that converts L-amino acids into the corresponding alpha-keto acids with hydrogen peroxide and ammonia as byproducts. In 1962, Zato and Hanahan purified and characterized the phospholipase A2 from eastern diamondback snake. In 1969, Wu and Tinker studied phospholipase A2 from western diamondback rattlesnake. This enzyme hydrolyzes glycerophospholipids to form lysophospholipids and fatty acid. Snake venoms often contains multiple types of phospholipase A2 isoenzyme, resulting in extra difficulty for purification. For example, 8 phospholipase A2 have been isolated and sequenced from the venom of Australian king brown snake. The lectin-related proteins in snake venoms have been classified into true C-type lectins, which contain the carbohydrate recognition domain, and C-type lectin-like protein containing the carbohydrate recognition domain related non-carbohydrate binding domains. Batroxobin, a lectin from common lancet snake venom, was isolated by Stoker and Barlow in the year 1976. Kirby et al. Purified and characterized thrombocytin from common lancet snake venom in 1979. Snake venom metalloproteinases is a major component in most viperine venoms, and it is one of the important enzymes contributing to the toxicity of snake venom. In 1978, Bjarnason and two purified snake venom metalloproteinases from western diamondback rattlesnake venom and showed that the zinc in each of these snake venom metalloproteinases was at the ratio 1:1 approximately to the relevant protein. Removal of zinc from this protein abolished both proteolytic and hemorrhagic activities of this protein. Disintegrins are a family of integrin inhibitory protein with low molecular weight. They have RGD tripeptide sequence and cysteine-rich peptides isolated from various snake venoms. The integrin binding function usually depends upon this RGD motif. However, some disintegrin lacking this RGD motif can also bind and block integrins. In the late 1980s, Huang et al. Purified and determined the primary structure of trigramin, a disintegrin from bamboo pit viper snake venom. This opened a promising research field of the inhibition of integrin function by snake venom. Human tumor growth is accompanied by angiogenesis. So, anti-angiogenic therapy is also important for cancer treatment. Disintegrins purified from snake venom showed anti-angiogenesis effect. Leucurogin, a disintegrin cloned from white-tail lancehead snake venom, showed significant anti-cancer activities against tumor in mice models. Contortostatin, a homodimeric peptide isolated from the venom of copperhead snake. It contained a RGD sequence and showed anti-angiogenic activity against the primary tumor of human breast cancer. Optustatin, a disintegrin isolated from West Asian blunt-nosed viper venom. It has no classical RGD sequence. Optustatin reduced the tumor size in mouse model and showed 84% inhibition of angiogenesis in the experimental studies. Adinbitter, a disintegrin clone from Siberian pit viper with 73 amino acid residues including 12 cysteine and a RGD motif. Adinbitter is a good anti-angiogenesis factor. Salmosin. It was purified from the snake venoms of pit viper. Treatment with salmosin significantly suppressed the growth of both the metastasis and solid tumor in mouse models. Apoptosis induction is another strategy to kill cancerous cell. A subset of snake venom proteins have demonstrated anti-tumoral activities by inducing apoptosis. In 1993, Araki et al. Found that some hemorrhagic snake venoms induced apoptosis of vascular endothelial cells. However, the active component was unknown. Sur and Kim purified and characterized L-amino acid oxidases from the venom of pit viper, and exposure of this enzyme resulted in the apoptosis of cultured mouse leukemia cell lines. Soumya et al. Purified and characterized a homodimer L-amino acid oxidases from common viper venom. This showed apoptosis in cultured HeLa cell lines. Thangam et al. Purified the disintegrin from the venom of Indian cobra snake. It showed a good anti-cancer activity. Two metalloproteases, disintegrin family proteins, VAP and VAP-A2, were purified from the venom of western diamondback rattlesnake. The apoptosis inducing activities seem to be specific towards endothelial cells. Han et al. Characterized stenitin, a snake venom metalloproteinase, from the venom of green pit viper. It comprises of metalloproteinases and disintegrin. The DNA fragmentation and flow cytometry analysis suggested that it has apoptosis activity. One of the major barriers in exploring snake venom is the low amount isolated from the venom glands, especially of rare snakes. The snake genomics will increase the discovery of the snake venom protein and peptide for the development of new drug for potential use. Researchers are working on the new drug delivery systems. One of the plausible strategies of cytotoxin is to conjugate the drug with monoclonal antibodies that recognize and bind to specific epitopes on malignant cancer cells. As an example, Zeatar used an anti-nasopharyngeal carcinoma monoclonal antibody BAC5 conjugated with the venom of the Chinese cobra, which showed strong effects against nasopharyngeal carcinoma cells in vitro. The other method for targeted therapy is to combine the cytotoxin with silica nanoparticles. Al-Sadoun et al. Demonstrated that the snake venom extracted from desert cobra combined with silica nanoparticle can inhibit the proliferation of human breast carcinoma cell lines and strongly induce apoptosis without significant effect on normal breast epithelial cells. It was concluded that the application of snake venoms in cancer therapy has evolved from the usage of crude mixture in 1930s and thereafter the isolation of certain biologically active components targeting specific molecular pathways. Currently, the combination of snake venoms with other technologies such as nanoparticle is still at its early stage for cancer therapy. It is expected that more combinational treatments will emerge. Snake venoms are definitely valuable resources for cancer drug development. A detailed report of this information is available in the journal Toxins 2018.
Thank you for watching, and I'll be back with more interesting scientific facts. This is Soumya's capsules enriched with knowledge.